My name is Liz, and today we're going to look at our new chemical dependency assessment using the ASAM or ASAM criteria. The ASAM criteria is the most widely used and comprehensive set of guidelines for placement, continued stay, and transfer or discharge of patients with addiction and co-occurring conditions. Let's have a look by clicking on this button here, and we're going to go right in here to dimension 1 and work our way across each of these dimensions until we get to the final tab. Okay, we can get a patient's history. There's a couple of different histories that we can do. Let's take a peek at each of these. Chemical use history. Information was received from the patient, maybe the family, what drug was abused. Let's just go with alcohol for right now. There are signs of dependence. This patient's tolerant, withdrawing, uses despite problems, and has had obligation failures. Length of use has been for years. Pattern of use is chronic or continuous. Last used just a couple of hours ago. Withdrawal is likely, uses alone. Amount used, I'm going to say, is to the point of intoxication. If the patient's abused other drugs, you can capture that. You can also talk about negative direct consequences, negative medical or social consequences, and you can talk about prior treatment history. Let's go back. And if you want to do a withdrawal history, we can just capture that right here. This patient does have a withdrawal history within the past year. Symptoms included sweating, nausea and vomiting, agitation, irritability, confused speech, maybe some hallucinations. And we don't have seizures on here, but I'm going to put that on here. Just add that in here. I could actually make that a custom button. That's something that we need to add to the program. And I'm going to go back. And let's look at our CIWA, the Alcohol Withdrawal Checklist. Okay, so we can click on this. And it's basically going to give you a scale. The first couple of options are going to give you the opportunity to talk about vital signs for the patient. Systolic blood pressure, let's just go with 130. Diastolic is over 60. Pulse rate is about 100 a minute. O2 saturation, if you're doing that with a pulse oximeter, 99% respiratory rate. Let's go up here to 22 per minute. And then here's the scales that you can look at. Nausea, you're rating these on a scale of 0 to 7. I'm going to say this patient has intermittent nausea. Tremors are severe. Anxiety is moderate. Agitation is this patient's constantly in motion. Paroxysmal sweats are occurring in moderately, so on and so forth. You can talk about orientation, tactile disturbances, auditory disturbances. Maybe there's severe auditory hallucinations. This patient's looking more and more like they're going into DTs. If there's visual disturbances, you can capture that. Headache, and then you can click here to produce a total score. Working down here, this is the intoxication withdrawal rating, risk rating scale. And you need to pick one. 0 meaning the patient's highly functional and is going to be able to tolerate withdrawal and cope comfortably. I'm going to come down here and pick number 4. This client is incapacitated with severe signs and symptoms. Client displays severe withdrawal and is a danger to themselves or others. Okay, puts that sentence right in here for you. Let's go over here to dimension 2. These are biomedical conditions and complications. Once again, you pick how the patient is functioning and rate them. There's some points to consider over here. You might want to read through these before you make a decision. I'm going to say that this patient scores at a 3. Patient tolerates and copes poorly with physical problems or with general health, etc. Patient neglects medical problems without active assistance, and so on. Let's go over here to dimension 3. And there's a couple of different areas we can look at. We can do a global appraisal of individual needs. And I'm going to say that this patient is depressed also. Within the last month, difficulty sleeping. Within the last month, let's see here, lied or conned within the last year, difficulty paying attention within the last month. this patient's bullied anybody, you can put that down, but I'm going to say rarely here. Either physical fights. Is this patient a victim of abuse? And I'm going to say has never been abused. You can talk about victimization danger if you need to. Okay, let's look at treatment history. Under Dimension 3, prior care setting. This is pretty straightforward. You can put down the name of the physician if you need to. Jane has been under the care of a physician, and I can just pop in Susan Jones, MD. Just to give it a little bit more detail, you can talk about a non-prescription or non-physician prescriber, what hospital the patient's been treated in, and so on and so forth. Let's click on this button here that says treatment a failure. Maybe when the patient was treated last time, the symptoms worsened, or the patient was non-compliant, or there was a deterioration of functioning over time. Is there a prior psychiatric disorder? And I'm just going to come down here and say yes. Say we had depression. And then you can detail age of first onset, how long the episode lasted, and how it was treated. Let's go back. Immediate risk factors on Dimension 3. Let's talk about the reliability of information they're getting historically from the patient. Is it reliable? Unable to assess reliability? Are there conflicting accounts? Or do you want to say that the information has not yet been verified? If the patient's suicidal, I'm going to say this patient is maybe guarded about suicidal ideation. Under suicidal history, there has been some recent attempts or past attempts. You can capture that. Self-injurious behavior, dangerous behaviors, unsafe driving while intoxicated perhaps, danger to others, denied. Is this patient gravely disabled? Yeah, this patient has psychotic features, hallucinations, and let's say they're tactile type. Okay. For medical and detox risk factors, if there's a medical condition, you can talk about that. This patient is under imminent withdrawal signs and symptoms, so I'm going to say this patient's sweating, tremors, shaking, irritable, confused speech, and has diarrhea. Let's go back. We can come over here, and there is a mental health disorders and complications scale that we can put in here. Starting at 0, once again, if this patient has good impulse control and coping skills, they would be at a 0. I'm going to come down here and select number 4 for our patient here. Patient is incapacitated by mental illness and may be impulsive or disorganized. Client is considered a danger to self or others. Consequently, involuntary commitment is needed. Under here, on Dimension 4, treatment acceptance or resistance. Once again, patient's compliant or open to the suggestion. Down here at number 4, you're given two choices. Number 1 saying A, the patient is non-compliant with treatment, has no awareness of their addiction or mental disease, and is not willing to change or is in total denial. Or this patient is dangerously oppositional to the extent that the patient or the client is in threat of imminent harm to self or others. So I'm going to click number 4 to show you how you handle those two options if only one is correct. So I'm going to say that number B is correct, and I'm going to erase A. Client is cut. Client is, let's get that happy face out of here. Dangerously oppositional to the extent that the client is a threat of imminent harm to self or others. Let's go over here. And these, once again, are points to consider before making in this determination. Under Dimension 5, risk of relapse. Patient's already relapsed once. Let's go down here. Patient has poor recognition and understanding of relapse and recidivism issues and displays moderately high vulnerability to further substance abuse or mental health problems, etc. That sounds like a good choice for this patient. Under Dimension 6, this is a support system, social setting, kind of a scale. And let's see here. For example, number 2 is right here in the middle. Patient is engaged in a structured, meaningful activity, but peers, family, significant others, and the living environment are unsupported. Or there is criminal justice involved by the client, or among the client's peers, significant others, or in the client's living environment. So let's say that this patient is hanging out with a bad gang of peers, so I can go ahead and put that down. Of course, we have other options down here as well. Under recommendations, the first thing you can put in is your diagnosis. If you know your diagnostic number, you can type it in. Your diagnosis will print out right here. I'm going to go right into DSM-5, which is set up in here by default. And I'm looking for substance abuse. We're going to work left to right across these fields. I'm going to scroll down here. Substance-related and addictive disorders. I'm going to say this is an alcohol use disorder and alcohol withdrawal with perceptual disturbances. It's an active diagnosis right now. We're going to click done. The diagnosis shows right up here. If you had, once again, if you had known this number, you could have typed the number and this would have displayed for you automatically. Okay. I'm just going to add excess 1 because I'm not using DSM-4 now. Okay, I'm going to say this patient needs to be in a residential setting. Reason for level of care. Patient has a past history of withdrawal seizures and is experiencing tactile hallucinations. We'll complete this note. Here we go. It was completed at this date and time. Here's your chemical dependency assessment. Diagnosis is at the top. And then each dimension is detailed exactly the way that you had filled it out in the program. There's dimension 2, dimension 3. You can see we have lots of good details here pushed in very, very quickly. Of course, you can always type in sentences to individualize this note. We have our acceptance rating scale here, our relapse potential rating here, and our recovery environment rating risk. Recommendation is for a residential or inpatient facility, and this is the reason why. Here's your signature line, and I'm going to electronically sign this. We're going to go back to the chart phase to find this information right here under Chemical Dependency Assessment. You can see that this note has pushed forward some vital information into the diagnosis and into the notes and risk factors.